Welcome back to Health, Hygiene and Wellness. We are still discussing about sickle cell anemia. Dr. Silas is still here in the program. I hope by the end of it all that you will be informed. Now, Dr. if we can just begin from here. Yeah. Where does, which part of the body does sickle cell anemia affect mostly?
You know, it's a good question.
Yes.
Sickle cell anemia affects every part of the body, except the hair and the nails and anything that does not have life, because hair and nails, actually, they have life, but they don't have full life, because blood circulates everywhere.
Yes.
So wherever that clot will actually stick, or maybe the red blood cells will clog, that's where you will get the complications.
Yes.
But I can't say sickle cell anemia is that bad that it affects every part of the body. But again, it clogs. Like for example, in boys,
yes,
we usually have complications here. There's a complication called priapism, whereby a child can have an erection for almost 3 days.
Continuous erection.
Yeah, continuous erection. And you know that how painful that can be.
Yes.
Because now the blood enters the penis and maybe it sticks there, and it becomes very painful to the child. Sometimes we have to drain the blood. So that's the most common complications. Sometimes we have chest pain. The child has a lot of blood clogging in the chest. They can get even pneumonia, and that causes chest pain. And even in the bones, they always have pain in the very severe pain in the bones. Sometimes we use even very, very strong painkillers to relieve that pain. So it can be that serious when you have not controlled sickle cells. But we thank God, because nowadays we have drugs that we can use. We look at that in the treatment that can prevent the formation of those sickle cell shaped cells. So if we use that drug, if your child is coming to the hospital, is attached to a clinic, they'll not have those complications. But it's good for the public to know that those complications are there. If your child is having those persistent erections that are taking 3 days, they are very painful. Bring them to the hospital. We can do the sickling test, put them on drugs, they will not have those complications. Those severe chest pains, those severe muscle pains, bone pains, joint pains,
actually,
it will be sickle cell.
At the point of bones, I was reading, and it was lucky that I passed through that when someone has sickle cell anemia, it can actually bend their bones.
Yeah, true. I told you there are deformities, because you know, first thing, the body is not taking enough blood to the bones, so the bones cannot grow. That's what I was telling you. These children, if you look at their head, it is not the normal shape of the head of other children. If you look at their bones, you know, the bones, the skull bones are affected, the femur, the bones of the lower limbs being affected, so it can bend. They are getting wounds. They can develop what we call osteomyelitis, an infection of the bones. They are just having wounds discharging pus all through from the bones. So there are bad signs, but those bad signs come to those who have neglected their children. They are not bringing children to school, to the hospital.
Yes.
But if you bring your child to the hospital, your child will be okay. They will not have those symptoms. You know, people, it's a disclaimer. People used to say in the old days that if you have sickle cell, you can't go past the age of 20 years. Currently, we have formed a sickle cell registry in the country. And we are lucky. The person who mans that registry is a sickler, a warrior, not a sickler.
A warrior.
A warrior.
Yes.
And currently is around 64 years. She's a lady. We have a professor who has sickle cell, 54 years. So who are we to tell these children that they lose life by 20 years? It's a matter of taking care.
And someone asks now, if they can display all these the signs and symptoms, and this is how they suffer.
Yes.
Can someone, a warrior, gain weight?
They can. We have warriors that in our clinic that you can't know they have sickle cell. What I'm saying is this: what drugs are you using? If you are using drugs that will prevent the formation of the sickle cell shaped, yes, you have the genetic predisposition.
Yes.
But we have a drug that is going to the bone marrow and telling the bone marrow, don't form these cells. Please form the correct cells. So that drug was discovered. So because the system, the body was supposed to be telling the bone marrow to form the correct cells. But now, because of genetic predisposition, your bones are not forming the correct cells. So we are giving you a drug that will tell your body to form the correct cells. Then you will continue with your normal life. But if you neglect, and at times those drugs are very expensive, that's what many people tell me. And it makes many parents not to buy those drugs for their children. So that is what is affecting the society, and that's why we are pushing for many people to come in. Even this month, we are discussing about sickle cell, because it was a sickle cell awareness month. There was, I think, which date was it? We were celebrating the sickle cell warriors.
Yes.
And we are advocating for many people to come and assist these children. There are not many. Those who have sickle cell, they are not many. It's actually less than 1% of our population, but it's really affecting people, especially people in the highly endemic areas for malaria.
Yes.
This western region, that is Nyanza, some part of Trans Nzoia,
Yes.
Kisumu, being affected, Bungoma, Kakamega. Many people are suffering from sickle cell. And mostly the areas that are affected by malaria, I don't know why, but they have a high risk for sickle cell. So we want people to come and help us curb this problem.
Daktari, someone may be watching us right now, and maybe he or she is thinking, if I'm near someone having maybe a sickler, the warrior as we call them,
Yeah.
they think maybe they can be transmitted to them. Is it transmitted to someone else?
Sickle cell is not transmitted. It is inherited. So if, for example, you have sickle cell, what we are advising people is that if you have sickle cell, of course you will get children.
Yes.
Yeah. But if you get a child, maybe a wife from a family that again has sickle cell, it can lead to most of your children having sickle cell. Maybe that child, if you marry a wife who, if you are a man and you have sickle cell, if you marry a wife who has sickle cell, most of your children will have sickle cell. If you marry a wife who is a carrier for sickle cell, some of your children will have sickle cell. So you have to look for, maybe, I don't know how best to put that, but you have to get a wife who is not having any trait of sickle cell, or they don't have sickle cell.
By any chance, does sickle cell relate any by any chance with the rhesus factor?
No, it doesn't. It doesn't. The rhesus factor is different. Rhesus factor goes with the blood group. Yeah. So sickle cell does not go with the blood group. Sickle cell just goes, we call them autosomal recessive. It goes with the genes that are inherited from the both parents.
Yes.
Yeah.
Okay.
Yeah.
Now let's look at the what to do and what to avoid. If you are having a sickle cell anemia, what should you avoid in order to live a healthy lifestyle?
To live a healthy life, if you have sickle cell, you have to prevent infections. That is very key, because infections will lead to what we call crisis. A crisis is whereby you are in pain. So the things that I was talking about, those priapism, those erections that are persistent for men, those chest pains, those bone pains, joint pains, they come because most likely have contracted an infection. So these children have to sleep in a mosquito net. If there is somebody you have to give a mosquito net, it's those children. These children have to take a lot of water. Even if they are going to school, if you are a teacher, allow a child who has sickle cell to carry water in their bags, because they have to take water. This water helps in washing away the cells that are clogging in the arteries. So if they take a lot of water, those cells don't clog in the arteries. Even if they are getting a crisis, the water will prevent the crisis. Then number two, you have to also put on prevention for infection, prophylaxis. We need to give vaccines to such children, and even booster vaccines. You remember, even during COVID, we lost quite a number of children who had sickle cell. No one was mentioning it on TV. They were just talking about diabetes, hypertension. We forgot about sickle cell. Because sickle cell, if you have sickle cell and you get COVID, again, it can lead you to geopathy. So at least you have to make sure that you treat any infection, including malaria. And if you are living in a malaria endemic zone, then you have to use some preventive therapy for malaria. You also have to use some preventive therapy for pneumonia and any other infection. Get vaccines for that. If there is any vaccines, it will help in preventing infection. The moment you notice your child has a fever, take them to hospital, diagnose the infection, treat it. Another way of preventing sickle cell is about preventing injuries, because those wounds won't heal.
Yes.
They take long to heal. So these are not children you can don't just leave to play without protection. So if they are going out for any games or any kind of play, they have to protect their areas that can get injuries. So they have to wear protective gears. Even shoes, they have to wear nice shoes to prevent them from getting injuries. Yeah.
What are the other ways that you as medical practitioners advise the sicklers to prevent themselves or to stay in a healthy lifestyle?
We are telling them, nowadays we have started a program, we are doing a registry.
Yes.
If you have a child who has sickle cell, then make sure these children come to us. First, we know they have sickle cell.
Yes.
We want to know how many. You know, this sickle cell is not a disease of the West so much. Many people in the West don't have sickle cell. So we have not done so much research about it. We don't know how to prevent these genes. If it were a disease of the West, they could have done so much research.
Yes.
So we first want to know the numbers. What is the prevalence? So let any child who has sickle cell come to the hospital. I know there are people who still believe sickle cell is a curse. It's not a curse. It's just a disease that was inherited from the parent. So no one cursed you. It's just something that came you didn't know. So that's one thing. Then for those who have sickle cell, we will want to stop the spread of sickle cell through genes. So if you are planning to marry, you know you come from a family that has sickle cell. That partner, the way we test for HIV, you know, if you want to marry nowadays, by the way, you should know that you need to test your partner for HIV. HIV has taken, we call it bottom up. It was affecting those people who are older. Nowadays, HIV is affecting people who are young.
It's true.
These people from 20 to 30 years. Anybody you see from 20 to 30 years, they have HIV unless proven otherwise. I'm sorry to say that on TV, but it is a possibility that they have HIV unless you test.
You test.
So if you want to marry anybody, again, if you have sickle cell, so that you don't spread, or maybe not spreading, but your children don't inherit. You know, children are very innocent.
Yes.
So you don't want them to get a disease that they wished not to have gotten it. Let this wife that you want to marry, bring them to hospital. The same test that we did for you. If they do it and it turns negative, we'll allow you to marry that wife. But if it's positive, we can accept, yes, that you marry the wife, but there is a risk that children will have sickle cell. You understand?
Yes.
So it's a way in situation. So if you can accept, and as a couple, we do a lot of couple counseling. If we realize there is a risk that your children will get sickle cell, then we better now look for another option. So that's what we are doing. It's a bit against the law of God, but now we also want to prevent the continuum of sickle cell. You understand?
Yes.
Yeah.
So it means right now when someone wants to marry, they should first check for HIV and sickle cell and other predisposition factors.
Not really, but if you know there's any family member in your... First of all, it's good for you to come for genetic testing. If you have a risk for sickle cell. If you are a lady, you want to get married, go and test. Do I have sickle cell? Am I a carrier of sickle cell? That's number one. Then the next thing, if you get somebody, ask them, is there somebody in your family who has sickle cell? They won't know even why you are asking. Then secondly, if there is that risk, if you already have a risk, just test. We are not testing everybody, no. But if somebody is willing to come for the tests are available. Just walk in a hospital, look for sickle cell, it's not there, I'm fit to go. Then again, if you have already tested for it, tell your partner that I've already tested for sickle cell, it's not there. Then you can continue in life. You know, it's very difficult to manage 4 children who have sickle cell. It is better you could have tested earlier, so so that you prevent getting children who have
it's
sickle
true.
cell. We are not saying children who have sickle cell should be stigmatized or they are bad children, but if there's a way to prevent it, why don't we prevent it? Or what do you think? I don't know.
Prevention is better than cure.
Prevention is better than cure.
Now, Doctor, how do you treat, as we wind up, how do you treat sickle cell?
I think I had mentioned the sickle cell is a chronic disease. It doesn't get healed, but at least we prevent the complications. Because once you develop sickle cell, you will live with it for your entire lifetime. If you are to live for 80 years, you will live for 80 years with sickle cell. But now, what we look at, because this is something that is in our body, yes, so we want to control the formation of the sickle cell shaped cells.
Yes.
So we want to give you a drug that will prevent that. We'll give you what we call prophylaxis against diseases.
Yes.
Like if you are traveling to a malaria endemic zone, we'll give you treatment so that you don't get malaria. Or if you get malaria, it doesn't become severe. After that also, we'll also look at we'll also want to look at your lifestyle. If you are getting any infection, we treat them. We are forming clinics for sickle cell in most county hospitals. If you walk to any county hospital and ask for a sickle cell clinic, you will be told the sickle cell clinic is there. Mostly it's being run by pediatricians and physicians, and they'll help you. So don't stay with your child who has sickle cell at home.
Yes.
And yet there is a service that can be provided to prevent your child from getting complications. These children must attain their years that God planned for them. So if you have a child who has sickle cell, let people not convince you in the villages that you will lose this child after 20 years. So don't put so much resources. I've seen parents who even don't take children to school who have sickle cell just because they know these children will die. No, that's the worst thing. These children will live, they'll go to school, they'll come back to help you as a parent.
Yes.
So take them to school, take them to hospital, let the medical practitioners take over and they'll help you.
All right. Yeah. Any last remarks, Daktari?
I think the one that I did was a last remark. I just encourage those parents who are, as we observe this month of sickle cell. I know a lot of things can be told about sickle cell. If you have a child who has sickle cell, there is a strength in it, you know. First of all, educate this child to prevent the strength. The theme of this year, we are looking at it. Let this child who has sickle cell not get a child again who has
sickle cell.
That is the message you are passing across.
Yes.
So whenever you see them with girlfriends and any other person who appears to be like they can be your daughter-in-law, ask them to go and test. If it's a girl, again, ask them to look for partners, test them. If these partners are negative, they'll get children who don't have sickle cell. There is a risk, a small risk.
Yes.
But at least you'll be wiping away the chins of sickle cell. That's number one. Number two, let these children come to hospital. Let them get the right information, let them get the right treatment, and they'll live their entire life. They'll get children like others, they'll live like other children, and they'll continue with their life forever. Nothing like 20 years, they'll go past 20 years. Yeah.
All right. Thank you so much, Dr. Silas, for the education that you've just given us. I think by the end of it all, the viewers right now are informed about sickle cell anemia. They know what they can do and how they can go about it after all. Thank you so much as well for watching Health, Hygiene and Wellness. My name is Barasa Saenyi. Until next time, goodbye.